Hi everyone. So we just got finished talking about blood pressure gradients, and then we talked about resistance. So now what we want to do is put all of this together and what it has to do with blood flow. So remember, there's your total blood flow. We already know what total blood flow is. We talked about this. And remember, I introduced this at the very beginning of the section and how flow is going to be proportional to this blood pressure gradient divided by resistance. So what does that mean? All right, so there it is again. So these are going to be all of the things. If we want to be able to increase blood flow, let's talk about what is the perfect thing that our blood pressure is doing and our blood vessels are doing. So as our pressure increases, that means that total blood flow is going to increase. So that's one thing you're going to find is that pressure and flow are going to be directly proportional to one another. So when one increases, the other one's going to increase. But resistance are going to be inversely related to flow. So that means whenever resistance increases, blood flow decreases. So let's take a look. As the blood pressure gradient increases, total blood flow is going to increase. And usually the way that you can increase blood pressure is going through an increase in cardiac output. So that's what it's showing right here. If you increase cardiac output, you actually have a steeper pressure gradient. It gives you a bigger pressure gradient, and that's going to help increase blood flow. But that's assuming that your blood vessels are going to be, staying like they need to as well. So that's another thing. If we want a nice increase in total blood flow, we can add in resistance. You want as less resistance as possible. So you want vasodilation to occur. You want to make sure that, or not necessarily vasodilation. So remember that your blood vessels are usually slightly constricted to help with blood flow and pressure. So as long as there's that normal vasomotor tone in your blood vessels, then you are good. But if you need to increase blood flow, then the body can go in and cause vasodilation. Got to make sure that there's not too many blood vessels as far as length, and of course that the viscosity is normal. So this isn't a perfect world, and factors that can help go in and increase total blood flow. Let's see some factors that go in and decrease blood flow. Obviously, if you have a decrease in cardiac output, look at that pressure gradient. It is going to decrease. And then, so that's showing what normal is. Let's take a look at that chart a little bit. This dotted line shows normal. This is what happens whenever the blood pressure gradient decreases. And that is going to decrease your total blood flow. Also, if you have vasoconstriction occurring, if you have an increase in your vessel length, and also if you have an increase in blood viscosity, those are all going to decrease blood flow. So let's take a look and see what happens if you do have sustained increase in resistance. So one thing that, remember that resistance has to do with, there's three factors. Diameter, length, and viscosity. So that is what you are looking at. So if you have any kind of sustained increase in resistance, and what I mean by that is, let's say that you smoke and you have sustained vasoconstriction happening in your blood vessels, more than just normal vasomotor tone, but more substantial vasoconstriction occurring. Or let's say that you are obese, and that means that you're going to have an increase in the amount of vessels that you have and their length as well. Or let's say that there's an issue with blood doping, so you have an increase in blood viscosity. Let's say that you do have this sustained increase in resistance for some reason. So what happens, let's write it out. Let's write out our formula. Usually what happens when you do increase resistance, you decrease blood flow. The body doesn't want that, right? The body does not want this happening to blood flow. It wants to keep adequate perfusion. So what it's going to do is it is going to do whatever it takes to increase and keep that blood flow normal. So one way to do that is to increase pressure. So it's not the best thing to do, but if the body needs to make sure that the tissues get adequate amount of blood supply, then it is going to go in and increase pressure that way. So that is why it says it generally correlates with arterial blood pressure. So if an individual does have, is smoking and they have vasoconstriction, then they might find that their blood pressure is elevated because the body is trying to do whatever it can take to not let this happen and to make sure that it has adequate blood flow. That's why an individual that is obese is one of the things that can cause an increase in their blood pressure is going to be this fact that they do have an increase in the length of their blood vessels. An individual that is blood doping, they might find their blood pressure increasing as well because of it. So it's going in and creating this greater pressure to try and overcome this resistance to make sure that blood flow stays like it needs to. So that's why you'll find increase in pressure in some of those situations. So now we're going to be taking a look at is what is the body going to do to make sure that it regulates and keeps blood pressure at this 120/80? Because it is really important to make sure that the blood pressure stays in this normal range. If it doesn't, there's going to be consequences. So the next section is going to be taking a look at this regulation of blood pressure, and in turn, that's going to regulate blood flow. So until next time.